Welcome back to another episode of HealthCap Weekly Wrap.
Yeah, thanks for joining us. This week, we've got some big stories that really speak to where the senior living industry is headed,
Right, like new audits from CMS that could mean real financial consequences for skilled nursing communities.
and an OIG investigation into how medical directors are actually spending their time and whether that's lining up with what's reported.
We're also diving into some eye-opening data from Liberty Mutual about liability claims. Spoiler alert, they've doubled over the last decade.
Yeah, and not just more claims, but more expensive ones too, especially in high acuity settings.
But it's not all pressure and oversight. We've got a really smart, practical story about improving communication between care providers and senior living.
And we'll wrap up with a couple of clinical insights you don't want to miss, including what's going on with norovirus and a new approach to emergency response that's actually improving outcomes.
Let's get into it.
So, have you seen what CMS is rolling out with these new sniff audits?
No, what's going on?
According to McKnight's long term care news, CMS is launching something called the Skilled Nursing Facility Validation Program. Starting in fiscal year 2026, they're planning to randomly audit up to 1,500 communities each year to check the accuracy of MDS data used for quality reporting and value based purchasing.
Wait, so they're actually digging into the source data?
Exactly. Each selected community will have to provide medical documentation for up to 10 sampled residents. And here's the big one. If you don't respond to the audit notice in time, you could face a 2% cut to your annual payment update.
Wow, 2%? That's a serious hit.
It really is. And while the audits themselves aren't penalizing you for errors, at least not yet, it's more about verifying that the data matches what's in the chart. Proactive LTC experts call this the tip of the iceberg, suggesting it's the start of much deeper data validation efforts.
Yeah, that definitely sounds like CMS is laying the groundwork for bigger oversight moves down the line.
Right? And this ties directly into another story. From the Physician Alliance of Long Term Care Medicine, the OIG is launching an evaluation of how nursing homes are engaging their medical directors.
Oh, I saw that headline. What's the focus? Staffing levels?
Close. The Office of Inspector General is looking into whether medical directors are actually performing their federally required duties and whether the hours reported in the payroll based journal system are accurate.
So this isn't just a paperwork thing. They're looking at whether these directors are really showing up and contributing?
Exactly. The OIG wants to assess how useful PBJ data is for oversight and whether nursing homes are compliant in how they engage medical leadership. They expect to release the findings in 2026.
Sounds like a wake-up call to make sure your documentation is rock solid and that your medical director is doing more than just signing the paperwork once a month.
Yeah, this isn't the time for box checking. Between CMS audits and OIG evaluations, the message is clear: transparency and accountability are front and center.
Okay, so let's talk liability, because the numbers coming out this year are kind of staggering.
Really? What are we seeing?
According to McKnight's long-term care news, liability claim costs in senior care have doubled over the past decade, and the biggest impact is being felt in skilled nursing communities, especially those serving higher acuity residents.
Yeah, I mean, that tracks with what a lot of operators are dealing with. But doubling, that's a massive shift.
It is. And when you dig into the 2025 Senior Care Claims Study from Liberty Mutual, it gives you a really detailed picture. The most frequent claims are still fall-related injuries, but the most expensive ones? Those come from pressure ulcers, abuse allegations, and elopement cases.
So fewer in number, but they hit a lot harder financially?
Exactly. And more than 40% of all closed claims involved wrongful death allegations. That's a huge portion of the total volume.
Wow, that's a tough stat. And I'm guessing the legal landscape isn't making things any easier?
Not at all. The report actually highlights something called reptile theory, a courtroom tactic where attorneys try to frame the provider's behavior as a threat to the resident's safety. It plays on fear, and it can lead juries to award much larger settlements, even in states with damage caps.
So instead of just focusing on what happened, the case becomes about whether the community created a dangerous environment overall?
Exactly. And when that narrative takes hold, it's hard to undo. Liberty Mutual even points to legal system abuse as a growing concern, cases being driven more by strategy than by substance.
All right, so what can communities actually do with this information? It feels like a lot of risk without a lot of control.
Yeah, but there are concrete steps. The report emphasizes the importance of strong risk management programs. That means investing in fall prevention strategies, consistent wound care assessments, clear abuse prevention protocols, and well-rehearsed elopement responses.
And the good news is, HealthCap has free resources on all of these topics. Whether it's checklists, training tools, or quick reference guides, there's a ton available to help communities build out their risk management efforts without starting from scratch.
That's huge, because when you're trying to juggle staffing, care, documentation, it helps to know you don't have to reinvent the wheel.
And I imagine documentation is key.
Absolutely, and HealthCap also has resources to help strengthen documentation practices, especially for those high-risk areas where clear, consistent notes can make the difference between a resolved claim and a costly lawsuit.
So this isn't just about avoiding lawsuits, it's about building the kind of care environment and paper trail that protects everyone involved.
Exactly, and with claim costs climbing the way they are, being proactive is no longer optional, it's essential.
All right, so let's shift gears a little. I came across a piece on the CALTCM blog that really stood out. Not because it was some big new policy change, but because it was such a simple, practical improvement.
Okay, I'm listening.
It's all about signouts, specifically how coordinated communication between providers can prevent a whole lot of confusion. Dr. Ashkan Javahari shared a case where a resident's responsible party was getting conflicting messages from different providers. No one was doing anything wrong, but the communication just wasn't synced up.
Yeah, I think we've all seen that happen. One provider says one thing, another says something else. It makes the team look disorganized and the family starts losing trust.
Exactly. So, what this group did was implement a really straightforward solution: a shared Google Sheet and short, daily or near daily joint calls between providers. It wasn't complicated, just a structured way to make sure everyone was aligned before anyone communicated with the resident or family.
That's smart. No new software, no big tech investment, just tightening up the routine.
Right. And the impact was immediate. They avoided duplicate messages, resolved conflicts before they happened, and kept the care team on the same page. It improved not only communication, but the resident and family experience too.
Honestly, that's one of those low-lift, high-impact changes. It's not glamorous, but it works.
Exactly. And it also builds trust internally between team members and externally with families. That's huge.
So the takeaway here is don't wait for a communication breakdown to fix the process. Put something simple in place before things fall through the cracks.
Yep. Sometimes the most effective change doesn't come from a regulation, it comes from just being a little more intentional about how we work together.
All right, to close things out today, I've got a couple of clinical updates. These aren't front page headlines, but they definitely matter for anyone working in senior living.
All right, hit me.
First up is from the CDC's Emerging Infectious Diseases Journal. They're reporting a pretty major shift in norovirus trends here in the US. The genotype G2.17, yeah, the one that's been kind of under the radar, is now responsible for about 75% of outbreaks during the 2024 to 2025 season.
Wait, what happened to GII.4? That was the dominant strain for years, right?
Exactly. GII.4 dropped all the way down to just over 10%. So we're looking at a clear turnover in which strain is circulating most.
Interesting. Does that change how we prepare for outbreaks?
Potentially, yeah. While basic infection prevention measures stay the same, knowing which strain is dominant could eventually influence vaccine development or targeted testing strategies. And it's also worth noting that the season is starting earlier than usual. Instead of beginning in December like we've seen in the past, outbreaks are now showing up as early as October.
That's really helpful for planning. Especially with staffing and supplies, it's always better to get ahead of it.
Exactly. Now, the second study comes from the Medical Journal of Australia, and it's pretty fascinating. They looked at smartphone-activated volunteer responders, basically trained volunteers, who get notified when someone nearby has a cardiac arrest. The idea is to get help on site before EMS can arrive.
Wow, like crowdsourced emergency response?
Exactly. The study ran in Victoria from 2018 to 2023, and the results showed improved survival rates to hospital discharge when volunteer responders were activated.
That's impressive. Could something like that ever be adapted to senior living communities?
That's the big question. It might not be a direct fit, but it opens the door to thinking about new ways to partner with community resources or leverage tech to support emergency response.
Even just having quicker access to CPR trained team members or community volunteers could make a difference.
Totally, it's an area worth watching, especially as these systems get more refined.
All right, that's going to do it for this week's HealthCap Weekly Wrap.
Yeah, we covered a lot: regulatory audits, liability trends, a simple communication fix, and even a couple of clinical insights that could shape how we prepare for the months ahead.
Thanks so much for tuning in. If you want to dig deeper into any of the stories we talked about today, you can find all the details in the weekly roundup on Angie's blog at healthcapusa.com/Angie's-blog.
We'll be back next week with more updates, insights, and stories from across the senior living world.
Until then, take care and keep doing the good work.